Good afternoon, all. So, we have completed two major topics as we had described in the last lecture. We have completed mainly the stretching and mobilization. Yes, now moving to the third aspect, proprioceptive neuromuscular facilitation. Both the things that we have discussed, mobilization as well as stretching, they will be effective most of the cases. Majority, say for example, more than 50% of the cases you will be applying in orthopedic conditions. In some conditions, you will be applying stretching to neuro patients also. But more specifically, they were for orthopedic condition. એ બધું orthopedic patients ઉપર વધારે apply થાય એવી techniques હતી. Whereas now this technique, proprioceptive neuromuscular facilitation or PNF in short, it is more specific for patients with neurological deficit, neurological conditions. You might have heard the patients say this term paralysis, yes, or others discussing the term paralysis, yes, or one half of the body is not working. Ek half of the body is not at all working, completely paralyzed, zero response, yes, sensory response na hoy, motor response na hoy. There are no reflexes that you have learned, deep tendon reflexes, yes, ankle jerk, knee jerk, bicep jerk, tricep jerk, they will always be zero. Yes, response surge na apne one half of the body. So that is termed as hemiplegia. Hemi mean one half. Plagia means complete paralysis. So one half of the body is paralyzed. That is hemiplegia. Most of the techniques we are going to discuss are applied to neurological patients for PNF, but they will also be applicable to orthopedic condition. Few techniques, they will also be applicable to orthopedic condition. Yes. Now, as the name suggests, proprioceptive, the sense of joint. Yes, joint તમારું હમણાં કયા પોઝિશનમાં છે? Say for example, you are lying down supine. સીધા તમે હમણાં સુતા છો with your hand slightly flexed, elbow slightly flexed. Yes, and you are holding your phone. So at this time, your brain will know at every single moment that what is the position of all joints. તમારે અહીંયા જોવું ના પડે. Yes, you do not have to see your elbow, your shoulder, your wrist કે તમને ખબર પડે કે which movement it is in. Yes. Say for example, shoulder is slightly flexed, slightly abducted, elbow flexed to up to 90-degree, wrist slightly into extension and radial deviation, fingers and thumb are flexed. Yes, and adducted. So this will be the normal motion, say for example. So how will you see? You will not see the parts with your eyes. તમે જોશો નહીં તો પણ તમને ખબર પડશે. This sense is termed as proprioception. Yes, આ sense ને કહેવાય proprioception. Neuromuscular, yes, related to nerves as well as muscles. So as the name itself suggests, it is mainly for the nerves and the muscles. So your nervous system is mostly being trained by this process. And facilitation, facilitation means to elicit response lavo. Yes, that is facilitation. It was developed by Herman Kabat and Margaret Knott. Yes, Herman Kabat and Margaret Knott in 1940s. Dorothy Voss joined the team in 1953 and continued to expand and develop the treatment procedure and techniques. Margaret and Dorothy wrote the first PNF book published in 1956. So you can see this is an old technique, yes, relatively used widely in nowadays practice. It is very widely used. If you know what is PNF, if you know the basic principles, if you know how to apply the techniques, you will be able to handle neurological patients very easily. Yes, in the future when you are practicing or being part of the internship also. So you need to remember the names: Harman Kabat, Margaret Knott, and Dorothy Voss. Yes, so at the end, Margaret and Dorothy wrote the first PNF book. Yes, but Herman Kabat has its own concept. The main concepts was started by Herman Kabat and Margaret Knott. Later on, Dorothy Voss joined in. Yes, in 1953, and within 3 years, they published their first book on PNF. Yes, and from the same book, we have taken all the context. We are understanding the same things from the basics so that it will help you. Yeah. As the name suggests, neuromuscular facilitation, PNF. P, having proprioception, having to do with any of the sensory receptors that give information concerning the movement and position of the બોડી. યસ, કોઈ પણ મુવમેન્ટ જોઈન્ટમાં થશે ઓર કયા પોઝિશનમાં જોઈન્ટ છે એની ઇન્ફોર્મેશન આપે, those are termed as proprioception sense. Neuromuscular, involving the nerves and the muscles, and facilitation, that is making it easier or eliciting response. કોઈ પણ વસ્તુમાંથી રિસ્પોન્સ લાવવો હોય, that is facilitation. Yes. So example of facilitation in general terms, if I have to tell you, I make very easy question paper for all of you so that you all write the answers. So I am making it easier for you to respond. So I am facilitating response from you. Yes. Similarly, we will try making response through proprioception in nerves and muscles. એટલે આપણે joint position ની sense ઉપરથી ખબર પાડશું and એમાંથી આપણે response લાવવાની try કરશું. So you can see from the sensory aspect, proprioception is a sense. Yes, sense. There are two types of nerves in the body. Yes, there are also, you can say there are three, but for simplicity we are taking only motor and sensory. Yes, third is the mixed type. You are already aware of it. Yes, cranial nerves, you already know they can be sensory, motor, or mixed type. Peripheral nerves can be sensory or motor. Yes, sensory એટલે કે તમારા sensations ઉપર લઈ જશે. They will be producing the ascending pathway. Ascending pathway is made up of sensory nerves. Descending pathway is made up of motor nerves. Sensory pathway નું function શું? Periphery માંથી. Say for example, from your hand, it will take sensation to the brain. Yes, એટલે કે ઉપર લઈ જશે. That is why the term ascending pathways. Yes, specifically pain and temperature carried by anterior and lateral spinothalamic tract. Yes, so spine to thalamus, ascending. Yeah, opposite, thalamus to spine, thalamospinal tract. Yes, thalamocortical tract. So that is all example of descending. Why? It will create motor response. આપણે ક્યાંય પણ motor response કરવું હોય, muscles contract કરવા હોય, તો આપણું brain signal આપશે, generate કરશે pattern, અને ઈ પ્રમાણે spinal cord અને peripheral nerves through muscles ને signal મળે. Yes, so it is from the brain downwards. So the term descending signals here, or descending pathways. So from the proprioception, from the ascending pathways, we are trying to move and keep the muscles, or trying to stimulate the nerves and muscles. Yes, so involving the nerves and muscles ne આપણે stimulate કરવું, એની માટે easy કરવું movement, that is proprioception, through the sense of proprioception. Yeah, we try to elicit response from the nerves and muscles through the sense of proprioception, that is termed as PNF. આપણે મસલ એક્ટિવેટ કરવાની ટ્રાય કરશું, નર્વ ચેતાતંતુને એક્ટિવેટ કરવાની ટ્રાય કરશું by the sense of proprioception. જોઈન્ટ પોઝિશનની સેન્સ ઉપરથી એલિસિટ કરવું, ઈઝી કરવું, ફેસિલિટેટ કરવું, that is termed as PNF. Proprioceptive and sensory mechanisms are involved. Yes, all the sensations, even when you are touching the body part, it will give tactile information to the brain. Yes, તમે તમારો જ હાથ તમારા forearm ઉપર મૂકો, one hand you are keeping the hand of on the other forearm, that will also give you signals. Yes, that is tactile signals. Yes, superficial signals. So superficial signals પણ facilitate કરશે. Yes, it will also help in creating motor response. એટલે કે તમે ક્યાં ટચ કરશો patient ને while you are providing exercise also is a type of PNF. Yes, so whenever you try to touch the patient, that is also a treatment. Feed information to the nervous system. જેટલી information તમે આપી શકો એટલી તમે nervous system ને આપશો, and from that information પરથી you get a desired response. What is desired response? There are three sub desired responses. First, contraction for strengthening. Yes, એટલે કે muscle ને signal મળશે કે એને strengthen થવા માટે, or contract થવાનું છે અને strengthening થશે એનું. Second, relaxation for stretching. Also we are going to see PNF stretching. Yes, in this. So patient should, as we already discussed in stretching, should always be relaxed. Patient એકદમ relaxed હોવું જોઈએ, તો જ તમારી technique effective રહેશે. And third, improve balance and equilibrium. Balance and equilibrium. Equilibrium and balance are the same terms used interchangeably. What does that mean? To maintain a patient's center of gravity within a fixed base of support. Yes, I hope everyone knows some amount of physics. Yeah, so Center of gravity located near the umbilicus, or more specifically at the level of L2 or L3, yes, of the spinal cord, which is to be maintained in the base of support. At this time, if you are lying down supine line, your base of support is from the uh, heel of your foot to the head. Yes, because everything is in contact with the floor. If you are standing, your both feet define the base of support. If you are standing with feet together, your base of support decreases. Yes, so to ability of an individual to maintain base of center of gravity in the base of support, that is termed as balance, and to perform action in that is termed as equilibrium. Yes, ઉભા ઉભા કાંઈ પણ activity કરવી, that is more of equilibrium. So static and dynamic, two types of balance will be there. એટલે કે ત્રણ રિસ્પોન્સ ફ્રોમ પ્રોપ્રિયોસેપ્શન અને સેન્સરી મિકેનિઝમ. એટલે પહેલા શું કરવાનું, આપણે પેશન્ટને ટચ કરશું, એની જોઈન્ટ પોઝિશન ચેન્જ કરશું, તો એમાંથી એને નર્વસ સિસ્ટમને ઘણી બધી ઇન્ફોર્મેશન મળશે. આ ઇન્ફોર્મેશન યુઝ કરીને there are three outcomes. આમાંથી ત્રણ વસ્તુ કરવાની છે આપણે. ફર્સ્ટ, કોન્ટ્રેક્શન કરાવશું મસલનું. સેકન્ડ, રિલેક્સ કરશા કે જેનાથી આપણે સ્ટ્રેચ આપી શકીએ. એન્ડ થર્ડ, ટુ ઇમ્પ્રુવ ધ બેલેન્સ એન્ડ ઇક્વિલિબ્રિયમ. Yes, three important things we want to create the patient to do. Yes, now we were taking example of hemiplegia. Yes, koi pan patient half body is affected, completely paralyzed. તો એમાં સૌથી વધારે શું જોશે આપણે, પહેલા તો ઇનિશિયેટ કરવાની મૂવમેન્ટ. યસ, સ્લોલી એન્ડ સ્ટેડીલી મોટર રિસ્પોન્સ લાવવાનો. મોટર રિસ્પોન્સ મીન્સ નર્વ્સ અને મસલને સ્ટિમ્યુલેટ કરવાનું, ફેસિલિટેટ કરવાનું. કઈ રીતે? થ્રુ ધ પ્રોસેસ ઓફ PNF. Yeah, so that is contraction. Relaxation is also induced in upper motor neuron lesion. Yes, upper motor neuron lesion, UMN lesion. There is increase in the muscle tone. Yes, why? Because of a structure, that is alpha motor neuron, present in the spinal cord. Yes, alpha motor neuron નું કામ શું હોય? It is induced to increase the muscle tone. Yes, હમેશા muscle tone વધારવું, that is the function of alpha motor neurons. But our brain has control over the alpha motor neuron in the spinal cord. આપણું brain હમેશા alpha motor neuron ને control માં રાખશે કે over excite ના કરે, muscle ને increase tone ના આપે. Yes, but when brain is injured, neurological conditions માં જ્યારે brain injure થાય, that is termed as upper motor neuron lesion. Yes, તો એ જ્યારે ઇન્જર થશે તો બ્રેનનો કંટ્રોલ આલ્ફા મોટર ન્યુરોન ઉપરથી વયું જશે. આલ્ફા મોટર ન્યુરોન ઉપરથી કંટ્રોલ વયું જશે. that means now it can send signal to the muscle to become completely in the contracted position. Yes, એ contracted position માં રહેશે, એને કહેવાય spasticity. Yes, you need to remember the term spasticity. Spasticity is seen in neurological patients with upper motor neuron lesion. Neurological conditions with upper motor neuron lesion. Upper motor neuron lesions એટલે કે the patient or an individual will have injury at or above the spinal cord level. Yes, say for example, if I want to tell you, if I have to explain you what is spasticity, consider muscle tone as pizza and you as alpha motor neuron. Yes, so you always want to eat pizza, તમારે રોજ pizza જ ખાવા હોય. Yes, but who is stopping you? Your parents. Yes, so your parents are the brain. Now if so, ultimately what is the chain? You always want to eat pizza, you are the alpha motor neuron, muscle tone is the pizza. You always, alpha motor neuron always wants to increase the muscle tone, but the parents, the brain is always stopping. Now say for example, your parents are going out of station for 2 to 3 days. What will you do? There is no control now. Yes, you can do whatever you wish to, so you will order pizza day and night. Yes, so that is what alpha motor neuron does to the muscle. It will increase the muscle tone and keep it contracted continuously. એટલે કે તમને feel થશે muscle tone has increased. To decrease this muscle tone, we need to stretch the muscles. Yes, so that is second response that we desire, relaxation for stretching. Yes, stretching માટે એ patient ને એકદમ relax કરવું પડશે. તો એ relaxation ક્યારે આવશે? when you apply PNF, and because of PNF there will be PNF stretching. So here the patient will be relaxed and later on you can apply the stretching. And third, as we talked about, to improve the balance and equilibrium, that is maintaining the center of gravity in a desired field, that is desired base of support. So three responses with just one proprioception and sensory mechanism. તો પહેલા તો તમે sensations આપશો, joint position change કરશો, tactile sensations આપશો, એનાથી આખી nervous system activate થશે એનાથી ત્રણ response આવશે. Either of the response is true, હા, ત્રણેય એક સાથે નહીં આવે. Whatever is desired, depending on the technique, there will be one response. Yes, one response out of these three is possible. That is what we discussed. Coming to basic neurophysiology. Yes, basic neurophysiology. How does this happen? What are the main principles on which this works? Yes, principles are different, but this is neurophysiology, normal terms that you might have learned in physiology that we are going to use in PNF. Yes, so first is after discharge. Now these things you have learned, so some of them I will ask you to let me know, so that I am sure you are attentive as well as you know your basic physiology. After discharge, this is tamne hamna, say for example, I or someone of your known gives you news that makes you angry. Yes, but then they tell you, okay, no, this was just a joke. Say for example, someone tells you your best friend had an accident. Yes, so you are angry, you are sad. Yes, next, very next moment that person tells you, no, I was just joking. So what will be your response? Your sadness will not just go away in a second. Yes, it will remain for some time. Yes, the same thing happens with the muscles. Even after the nerves are contracting or nerves are giving signal to the muscle through the neuromuscular junction, through the synapse, then also the muscle keeps contracting. So that is termed as after discharge. Yes, stimulus બંધ થઈ ગયું છે તો પણ તમારો response ચાલુ રહે. That is termed as after discharge. The effect of stimulus continues even after the stimulus stops. So say for example, ek pin tame lagadi, yes, on your forearm with your eyes closed, and you shout. Yes, immediately I withdraw the pin, but still you will shout. Yes, why? Because still you are feeling the pain. Yes, so this is after discharge. Even if the stimulus has removed, stimulus nathi, pin છે જ નહીં ત્યાં, તો પણ તમને pain થાય છે. Yes, so this is after discharge. Yes, if the strength and duration of the stimulus increases, yes, એકની જગ્યાએ 10 pin લગાડું and I keep it for 10 seconds. Yes, so strength also increasing, duration also increasing, after discharge also increases. અને હું તરત remove કરું 10 seconds પછી, તો તમને જે pain થશે એક pin લાગવાથી for 1 second, it will be more compared to 10 pins for 10 seconds. Yes, so if you want to increase after discharge, increase the strength and duration of the stimulus. Strength વધારવાની stimulus ની, વધારે pins I can insert, and even the duration, that is more amount of time I will keep it there. Yes, so it will increase the amount of discharge. હવે patient ને આપણે pin લગાડવાના નથી, this is just an example. Yes, so how it is helpful? આપણે જ્યારે પણ response જોતો હોય તો આપણે patient ને quick કાંઈ પણ નહીં કરાવી, we'll ask them to perform slowly, તો આપણે duration વધારીએ, and we will also provide resistance. Patient ને થોડુંક resistance આપશું, જેનાથી એની strength પણ test થશે, અને strength test થશે તો more and more amount of muscle fibers will come into play. Yes, and they will be stimulated. એટલે કે we will apply resistance, and we will apply resistance for long duration. તો after discharge વધશે, એટલે કે muscle વધારે ને વધારે activate થશે. Our main role here, think of the hemiplegia patient જે નથી move કરી શકતું, one half of the body completely paralyzed, એમાં જ વધારે કરવાનું છે. Yes, okay. Moving to second, temporal summation. Now temporal and spatial summation is something I expect you to know. What is temporal summation? You tell me. What do you understand by the term temporal summation? You learned this in muscle as well as nerve physiology. બંનેમાં વસ્તુ આવશે. What is temporal and spatial summation? What is temporal? Temporal means what? Temporal એટલે શું?
Sir, to
Yes. Your voice
and
is not clear. Your
some is the addition of milk
Can
curd.
you repeat? Can you repeat? You can write in the chat, that is fine. Write in short.
Of the
Anyone else would try to type or write in the chat, or even unmute yourself. If your voice is clear, that is fine. Otherwise, you can even write in the chat. Yes, what is temporal summation? Name itself suggests. Temporal means what? Temporal means it is related to time. Yes, temporal is always limited or related to time. So whenever you are providing stimulation, at that time, at the same moment, you are providing more than one stimulation at the same time. Yes, so that is temporal summation. It will increase the strength of the stimuli. Two successive stimuli given so that the addition of both will cause summation. Yes, say for example, now here comes action potential, threshold, all these levels. Yes, we will discuss about them. So say for example, at minus 50 millivolt, yes, is the resting normal now membrane potential. If it goes up to minus 90, then only it will be stimulated. એટલે તમારે minus 40 નો stimulus apply કરવો પડશે તો જ patient ને response આવશે, તો જ now stimulate થશે. Yes, now you are providing two stimuli of 20 millivolt, minus 20 millivolt. Yes, so what will happen, they will get summed up. એક જ સેકન્ડમાં તમે એ બંને લગાડી દેશો, બંને સ્ટિમ્યુલસ આપશો minus 20 millivolt ના, તો they will get summed up અને minus 40 કરીને એ response લઈ આવશે. Individually they cannot. minus 20 કરો તો nerve excite ના થાય, muscle excite નહીં થાય. Yes, but due to the presence of both at the same time, both at the same time you are doing, that is temporal summation. So a successive of weak stimuli, submaximal, subthreshold, threshold કરતા ઓછા stimuli તમે આપશો, occurring within short period of time, combined to cause excitation. Yes, within a short period of time. Say for example, provided in 1 second. એક જ જગ્યા ઉપર within a second you are providing, that is temporal summation. Spatial, related to space. So weak stimuli applied simultaneous to different areas of the body reinforce a summation each other to cause excitation. Yes, so say for example, forearm ma બે જગ્યાએ at the same time you are providing on different places. Yes, that will also add the stimuli. In temporal, it is within a small period of time at the same point, અને spatial ma બે different point at the same time. Yes, તો આ બંને stimuli પાછા response લાવશે. Yes, they will be added up. Again, minus 20 na બે stimuli, one at the wrist, one at the mid forearm level. Yes, you are providing at the same time. That will cause excitation. Why? Because minus 20, minus 20, they will be added up to minus 40 and it will create a response. Next, irradiation. Yes, I don't think you will be aware of the term, but irradiation means more and more number of fibers will be recruited. Yes, say for example, I ask one of you to lift a bench. Yes, so what will be the first muscle that you will that will help you to lift the bench? The first muscle will be of your hand, intrinsic muscle of the hand, and the wrist, forearm muscles. Yes, the flexor muscle. You will grasp the bench and you'll try to lift it with the wrist, but wrist does not have enough amount of power. So શું થશે, તમારા elbow muscles will start working, your biceps muscle will start working. Still the bench is heavier, so what will happen, your shoulder musculature will start to work. Yes, some amount of lifting is happening, but still it is not appropriate, so your back extensors will work and at the same time your bench will be lifted. Yes, તો પહેલા શું થયું, તમારા સૌથી પહેલા hand muscles activate થયા, પછી force એટલો બધો હતો, હજી તમારે force લઈ આવો તો તમારા forearm muscles activate થયા, wrist flexors activate થયા, then તમારા elbow flexors activate થયા, then shoulder flexors activate થયા, and last it to recruit was the back extensor. Yes, so why this happened, this phenomenon of increasing the number of recruitment of muscles is termed as irradiation. Resistance એટલું બધું હોય કે એને overcome કરવા માટે બીજા muscles act કરવા માંડે. Yes, which are synergistic muscle. These are all synergistic muscle. You already know about the synergist, yes, which help in a movement. So there is a spreading and increased strength of response when either the number of stimuli or the strength of stimuli is increased. Yes, if I want to give you an example, you might have learnt about the pump and the bucket handle movement of the ribs, yes, in the anatomy. So if you hold a bucket in you say under the tap and you open the tap, yes, slowly and steadily, pehla to bucket khali wrist movements thi j stabilize rehse. Slowly and steadily and weight vadtu jase, and because of this your elbow muscles, your shoulder muscles, and then your back muscles will come into play. Yes, so why this happened? Tame resistance vadaro છો. Yes, strength of stimuli is increasing, or you can even increase the number of stimuli. Yes, say for example I ask Ayush to maintain the hand into elbow flexion. Yes, and I try to push it downwards. Ayush is able to do easily, yes, with my force. Then I ask all other individuals, all the boys of the classroom, to apply force along with me, so I'm increasing number of stimuli. Yes, and then what will Ayush do? Ayush will try to move the arm into flexion, so shoulder flexion will happen. He'll try to move backwards, so back extension will happen. Yes, so that is irradiation. Say for example કોઈ patient માં wrist movements છે પણ forearm movements નથી, yes, elbow movements નથી, તો શું કરશું આપણે ત્યારે આ irradiation use કરશું. We will ask the patient to contract so forcefully wrist flexion માં એટલું resistance આપશું એને કે slowly and steadily through synergistic, through the phenomenon of irradiation, elbow flexor muscle activate થવા માંડે. Elbow flexor activate થશે, પછી shoulder flexors activate થશે, and slowly and steadily it will move and the patient will be able to do it actively also. Yes, so this is irradiation. Irradiation is nothing but એટલો સામે resistance આપવાનો, force આપવાનો કે patient ના બીજા muscles recruit થવા માંડે અને એમાં impulse generate થવા માંડે, response generate થવા માંડે. The response may be either excitation or inhibition also. Yes, so here what we talked about is excitation. Yes, irradiation most of the time we use for excitation purpose. Very rarely do we use for inhibition. Inhibition શું કામ? We are increasing the strength of stimuli so much. હવે એકવાર excite એટલું બધું થઈ ગયું, taking the example of bench, તો તમારા wrist flexors, forearm flexors, elbow flexors, shoulder flexors and back extensors all are activated. After this also it is not being lifted, તો શું થશે? પછી બધા જ muscle relax કરશે, બધા જ muscle give up કરી દેશે. You will understand, the brain will give signal, આ આપણા વસની વાત નથી. Yes, you are not supposed to do this. તો બધા જ muscle relax થઈ જશે. Yes, so that is example of irradiation to inhibit the muscle contraction. Yes, તો બધા જ muscle એક સાથે relax થઈ જશે. That is irradiation for inhibition. Moving to successive induction. So an increased excitation of agonist muscle following the stimulation of antagonistic muscle. કોઈ પણ muscle, say for example excitation of agonist always follows stimulation, that is contraction of antagonist. એટલે તમે biceps muscle ને stimulate કરશો અને જ્યારે bicep muscle relax થશે afterwards, એનું antagonist એટલે કે tricep muscle will always get excited. Yes, this is also same as reciprocal innervation that we have discussed. Yes, say for example elbow flex કરવું છે. Yes, so elbow flexion once you want to perform, for elbow flexion to be performed, bicep contract થવું જોઈએ, at the same time tricep should relax. Yes, but elbow flexion full થઈ ગયું પછી now elbow has to move into extension. Yes, so when agonist biceps is contracted forcefully, we have excited the agonist biceps. After that there will be antagonist stimulation, that is triceps will contract and move the limb into extension. Yes, so this is successive induction. Successive, ek pachi ek. Yes, induction, that is you are inducing. એટલે say for example tricep માં tone નથી, bicep માં tone છે, તો શું કરશું આપણે? biceps ને forcefully contract કરશું, એનાથી પણ tricep માં tone વધશે, because after a forceful contraction or excitation of agonist, antagonist માં already there will be contraction. This is successive induction. Technique involving reversal of antagonist, we'll be using it in the property. Yes, so there are few techniques of PNF. In the last portion, we are going to describe 7 techniques of applying PNF. One of them is reversal of antagonist, in which we are going to apply this principle. And last, I expect this you to know what is reciprocal innervation or reciprocal inhibition. હમણાં જ મેં describe કર્યું. What is reciprocal inhibition? Yes, please. What is reciprocal inhibition? I gave an example just 2 minutes back. So what is reciprocal inhibition? What do you understand by the term reciprocal inhibition? You can write in the chat or even unmute yourself. Yes, no one? Whenever we want to contract any muscle, at that time it is important that the opposite muscle should relax. Yes, when one muscle is contracting, at that time another muscle has to relax. Yes, very true. So this is reciprocal inhibition. Whenever તમારે કોઈ પણ movement produce કરવી હોય, એની માટે તમારે એક મસલને contract કરવું પડે. Yes, પણ સામે એનો જ antagonistic muscle પણ contracted હોય તો શું થાય? તો movement produce ના થાય. Yes, giving you an example of a door. Yes, you are pushing the door from inside to open it and someone outside is standing to push the door. Yes, બંને સામે push કરશો તો door હલશે નહીં હલે. Yes, other has to relax, other person has to understand, he has to relax, then only you can push and open the door. That is reciprocal inhibition. Contraction of muscle is accompanied by stimulation inhibition of their antagonist. Yes, so contraction of a muscle, biceps muscle is contracting, is always accompanied by simultaneous at the same time inhibition of their antagonist, and opposite muscle group will completely relax. Tricep has to relax, then only there will be elbow flexion. Otherwise, if both are contracting, it is termed as co-contraction, coordinated contraction, and because of this there will be no muscle action. કોઈ muscle action નહીં થાય ત્યારે. Yes, the work of Sir Charles Sherrington was important in developing the techniques of PNF. Many of the basic principles, temporal summation, spatial summation, irradiation, these are all observed by him and used by Herman Cabot and Margaret Knott. Yes, and because of that the PNF exists. So even Charles Sherrington plays a very important role in contributing towards PNF, basic neurophysiology. Relaxation techniques make use of this property. We are going to describe 2 important terms, contract and relax and hold and relax. So those relaxation techniques will use the reciprocal inhibition as their main agenda, main property. Okay. We're not moving to principles. We'll move to principles in the next lecture. Yes. Any doubts in introduction? That was relatively very simple. But most importantly, basic neurophysiology. તમને basic neurophysiology નહીં ખબર હોય, if you are not aware about it, it will not be easy to understand other techniques that we are going to describe. Even principles you will not be able to get because they are based on the neurophysiology. This is normal neurophysiology. Yeah? This is not abnormal. આપણે abnormally કાંઈ જ હજી જોયું જ નથી. Yes, we are just studying normal and how to apply on normal also. Yes, so after discharge will happen in you also. Temporal summation, spatial summation, irradiation, successive induction, reciprocal innervation, બધું જ તમારામાં પણ થાય છે. That is why I gave you the example of you only. Yes, how it is happening, why it is happening, and why it is needed for PNF. That also I have explained through this. Yeah. So in next lecture we are going to see the basic principles, then we are going to see the patterns of PNF, and last will be the techniques of PNF. That is all practical based. Patterns and techniques will be practical based, but till then there will be all theoretical aspects. Yes, any doubts till now? Any portion you didn't get from today's lecture, please write in the chat. Reply with yes or no with your doubts. Everyone compulsorily reply. How much portion is going to come in C exam? For my portion, it is more of only limited to two techniques. Yes, two things that you discussed, mobilization and stretching, including practicals. Yes, so including practicals, you have to go through them. Okay, can you repeat successive induction? Okay, successive induction is nothing but following a contraction of one muscle group, say for example biceps agonist, there will be a contraction of antagonist afterwards. Yes, compulsorily. Yes, if you are contracting your biceps, after that complete elbow flexion થઈ ગયું, પછી the hand has to move into extension. Yes, it cannot remain in flexion, you will voluntarily move it. Yes, so that is termed as successive induction. So after contraction of, say for example agonist, there will be contraction of antagonist. So if after following contraction of biceps, there will be contraction of triceps. That is same as understanding the effect of autogenic inhibition. Yes, what is autogenic inhibition? After a forceful contraction, કોઈ પણ મસલ તમે એટલું ફોર્સ થી કોન્ટ્રાક્ટ કરો પછી એને રિલેક્સ થવું જ પડશે. તો એ મસલ સામે રિલેક્સ થશે તો ઓપોઝિટ મસલ will get going to get stimulated. That is successive induction. Successive, one after the other. So agonist પછી antagonist પછી agonist પછી antagonist. Yes, this is the cycle. So successive induction. Demonstration video no mobilization provided before C exam. Yes, completely. Upper extremity, I guess I have circulated already. Lower extremity, I am going to shoot today itself as much as possible and be forwarding to you after editing. Yes, so be free about it. Stretching, of course, we have described all the things, and mobilization will be for sure given to you by today itself. Today or probably tomorrow morning, next tomorrow morning. Upper extremity, I guess everyone has seen the video. I have seen only 20-25 views were there, so I'm not sure everyone has seen. If you don't understand, see practicals. I'm going to ask you to perform and at least verbally explain it to me. Yes, so go through it. It will be for your betterment, for your better marks, and for your better practice in future. Okay, no doubts. Okay, Ayush, have you taken the attendance?
Yes, sir.
Okay, fine. So we'll keep it till here. In the next lecture, we'll move forward and see about the basic principles of PNF. Yes, hope you have a good day. Be safe.
Thank you, sir. Thank you, sir.
Thank you, sir.